pulp is blood, nerves, and connective tissue. The characteristics of a pulp is surrounded by hard tissue, which means that this pulp does not tolerate edema, lacks collateral irrigation, which means that does not does not cope with bacteria. The pulp has odontoblasts and mesenchymal cell osteoblasts. What controls sensibility of the pulp? A delta nerve fibers, which are myelinated, and they control acute pain. So acute pain comes from A delta nerve fibers, which are myelinated. And chronic pain comes from unmyelinated C afferent nerve fibers. Again, sensitivity of pulp, acute pain from A delta nerve fibers, which are myelinated, and from chronic pain from C afferent nerve fibers, which are unmyelinated. Pulpal diagnosis: normal, reversible inflammation, irreversible inflammation, and necrosis. A normal pulp is a symptomatic, mild, moderate response to vital test, no pain to palpation, and no pain to percussion. A reversible pulpitis is pain quick and sharp to vitality test, but disappears as soon as the stimuli is gone. If you take the irritant, pulp will return to normal. How can you separate reversible and irreversible pulpitis? The cold will cause pain and disappear. This means that it's reversible. If the cold causes pain and lingers, then it's irreversible. If there is no spontaneous pain, it's reversible. And if there is spontaneous pain, it's irreversible. Irreversible pulpitis microscopy is a microabscess of the pulp is present. You can still see myelinated and unmyelinated fibers in inflammation areas. That is irreversible pulpitis. The how you see microscopically a reversible and irreversible pulpitis. An irreversible pulpitis can be asymptomatic or symptomatic. An asymptomatic irreversible pulpitis can be hyperplastic and have internal resorption, or have internal resorption. That's asymptomatic irreversible pulpitis, hyperplastic or internal resorption. Hyperplastic asymptomatic irreversible pulpitis can be a growth of pulp like a cauliflower around the cavity. Is more prevalent in young adults because they are very vascular. That's hyperplastic asymptomatic irreversible pulpitis. Now, an internal resorption asymptomatic irreversible pulpitis can be discovered in routine x-rays. There are no chronic inflammatory cells, and there will be some necrotic pulp in the coronal aspect of the pulp. Okay. Now, symptomatic irreversible pulpitis. What is symptomatic irreversible pulpitis? Symptomatic irreversible pulpitis, there will be spontaneous pain, lingering pain, postural change triggers pain. X-rays are not conclusive. You may find thick periodontal ligament. Electrical test has no value. This is an asymptomatic irreversible pulpitis. Again, there is spontaneous pain, lingering pain, postural change triggers pain. X-rays are not conclusive. There may be a periodontal ligament thickening. The electrical test has no value. Now, necrosis. Necrosis can be caused by irreversible pulpitis, trauma, long-term interruption of the blood supply. Necrosis can be partial or total. Periradicular disease is when any periradicular lesion of pulpal origin or associated to irritants in the pulp. Signs and symptoms of periradicular disease. It can be asymptomatic or intense pain with fever. Radiographically, may be bone resorption, but may not be visible. Again, signs and symptoms of periradicular disease. It can be asymptomatic or present with intense pain with fever. Radiographically, you may find bone resorption, but not necessarily. It can also be non-visible. Periradicular disease diagnosis: acute periradicular periodontitis, acute periradicular abscess, chronic periradicular periodontitis, chronic periradicular abscess. I mean, yeah, chronic and condensing osteitis or chronic focal sclerosing osteomyelitis. These are all the periradicular diseases. Again, acute or chronic periradicular periodontitis and acute or chronic periradicular abscess and condensing osteitis or chronic focal sclerosing osteomyelitis. Now, acute periradicular periodontitis is a painful inflammation at the apex, occurs in vital and non-vital teeth. X-ray appears normal. Remember that if it's acute, you will have no change in the X-ray because it takes a while before you can see any decalcification or any damage to the bone. So acute periradicular periodontitis, painful inflammation of the apex, at the apex, occurs in vital and in non-vital teeth, and the X-rays appear normal. There may be pain at percussion because of inflammation of the periodontal ligament, and occlusal adjustments will alleviate in vital teeth. Now, acute periradicular abscess. Acute apical abscess around the tooth. The X-ray, normal or slightly thick, shows a normal or slightly thickness of the periodontal ligament. Okay. Um, where was I? Acute periradicular periodontitis, painful inflammation at the apex, occurs in vital and non-vital teeth. X-ray appears normal, pain at percussion, and occlusal adjustments will alleviate in vital teeth. Now, acute periradicular abscess, acute apical abscess around the root. X-ray normal or slightly thickened. It can be exacerbation of a chronic abscess, which is called phoenix abscess. Swelling is present. Pain can be moderate to severe. Pain, percussion, and pain with percussion or and palpation. It can become a cellulitis. This is acute periodicular abscess. Now, chronic periodicular periodontitis. A chronic periodicular periodontitis is a long standing asymptomatic or mildly symptomatic lesion. Extensive demineralization of cortical or cancellous bone. X ray shows bone resorption. There's an increase in anaerobic bacteria, and there's histologically can be a periarticular granuloma or cyst. Again, chronic periodicular periodontitis, long-standing asymptomatic or mildly symptomatic lesion, extensive demineralization of cortical or cancellous bone. X-ray shows bone resorption. There's an increase in anaerobic bacteria, and histologically, you can it can be a periodicular granuloma or cyst. Next is chronic periodicular abscess. A chronic periodicular abscess is associated with a sinus tract or fistula. It can drain by sulcus, periodicular bone loss. Negative to a pulp test. Next, condensing osteitis. A condensing osteitis is an excessive bone demineralization around an apex of vital tooth. It can be caused by low-grade pulp irritation, no symptoms, and benign, no treatment. The characteristics of a non-odontogenic involvement regarding pain. Episodes of pain with free remissions.